We are obviously living in a situation that is catastrophic for transgender people of all ages, particularly transgender youth, with actions from the Trump administration almost every day targeting our community that represents less than 1% of the population. And one of those orders sought to, in essence, threaten and coerce hospitals across the country to shut down care, including in places like New York and California and Illinois and Virginia, where people thought they were safe from the state-level bans that have been passing for the last several years. And what we're seeing now is that there is a lot of compliance in advance with this executive order, as the rally in New York made very clear. However, we also have to know that it is the Trump administration that is holding our entire medical system in the United States hostage to threaten people, to punish transgender people for simply existing. And it is not just transgender youth. This is an order that goes up to 19 years old. I have been on the phone with people who deliberately waited through their entire adolescence until they were 18 years old so that they could access medical care. And then they had those appointments canceled on the way to the hospital, on the week of those appointments. The devastation is staggering, and we are in federal court to make it clear that, first, the president does not have the authority to override Congress and decide how money that has been allocated by Congress, as the Constitution makes clear, can be taken away just because the president doesn't like how it's being used. And second, this action violates the individual constitutional rights of transgender adolescents and their families, as well as transgender 18-year-olds.